Namaste. Welcome you all for the yoga session. In this session, we're going to use a couple of blankets, a mat, and a chair. We're going to work with some of the bridge postures, especially the upward facing bridge. Bridge poses help to improve the strength and stability of the back, especially the lower back. We shall start with some basic postures for the core muscles. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back. That should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very, very attentively be done left leg down. Relax your breathing, watch your back, raise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg. Left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible. Then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chin. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side, sit upright, chest and navel up. Put one of the blankets on the lower rib of the chair. Rest your right palm. Then take both legs on the lower rib of the chair. Inhale, exhale, rise, keeping the left hand on the waistline. Hips up. Then stretch your left hand also up. Look up at your left palm. Slowly come down. On the lower rib, it may be difficult to keep the legs one on top of the other. So I can keep one foot slightly ahead of the other. Chain. Press the left palm. Right hand on the waistline. Both the foot on the lower rib. Inhale, exhale, rise. Rise your right hand up, look up at your right palm. So these side bridge also involves some balance. Flex your right hand, then slowly come down. Sit upright one more time, press the right palm. Middle finger pointing forward. Take the feet on the lower rib. Left hand on the waistline. Inhale, exhale, rise. Hip should not go too much back. Left hand up. Look up at your left palm. Do not hold the breath. As you exhale, contract the abdominal muscles. Feel the posture. Feel the complete trunk muscles. Flex left hand, slowly come down, change side. Press the left palm, both feet onto the lower rib of the chair, right hand on the waistline. Inhale, exhale, rise. Right hand up and look up. These side bridges help to gear up the lateral muscles of the trunk into action. The oblique muscles also get a good stabilizing movement. Flex your right arm, slowly come down. Now put the blanket on the seat of the chair. We are going to increase the height for the legs. Press the right palm on the mat, middle finger pointing forward. Take both legs up, left hand on the waistline, rise the hips. Now stretch your left hand in line with the right hand. Look up. Both legs straight. Arms, trunk, legs should be in the same plane. In this, you can rest the heel one top of the other. Flex your left hand, slowly descend. Change side. Press the left hand, feet on the seat of the chair, right hand on waistline. First take the right leg up, rise, then move the left leg also up. Well, open the chest. Stretch your right arm in line with the left arm and look up. Press the left palm completely. Feel the muscles of the trunk. Get completely involved. Develop the presence of mind. Flex the right hand, slowly descend. Sit upright. Repeat. Press the right palm. Left leg up. Then the right leg also up. Left hand on waistline. Inhale, exhale, rise the hips. Stretch your left arm up. Turn the neck, look up. The trunk muscles have to now gear up against gravity. They have to hold on to. And there is also an element of balance. So thus, these postures also help to gain better neuromuscular coordination. Slowly come down. Change side. Press the left palm. Right hand on waistline. Right leg up onto the seat of the chair. Rise the hips. Left leg also up. Turn the right shoulder. Stretch your right arm. Look up at your right palm. Tighten the muscles of the upper arms. Feel your shoulder complex. Feel the hip complex. Both legs straight. Do not hold the breath. Breathe at ease. Slowly descend. Sit upright. Put the mat, the blanket on the lower rib of the chair. Sit upright. Inhale, exhale, turn. A gentle twist. Turn to your right side. Left hand on right knee, right hand fingertips on the floor. These twists give a very relieving movement for the trunk muscles. Breathe properly. Do not hold the breath. Slowly come up. Chain. Left hand on right knee. Right hand on left knee, left hand fingertips on the floor. Turn the neck also in the direction of the twist. Slowly come up. Clasp the fingers in exhale, stretch both arms up, palm facing upwards. This is a good stretch for the arms. In all these bridge postures, the muscles of the arms are also involved. This gives a very relieving movement for the upper extremities. Feel the armpit, feel the upper arm, elbow, forearms, wrist, all the fingers. Slowly flex the arms. Lie on your back. Keep both the palm on the abdomen. Rest the ankle on the lower rib of the chair. Stretch both arms up on the floor. As exhale, contract the abdomen and rise the hips up. Legs straight. Do not hold the breath. With every exhalation, contract the abdominal muscles. So this is also an excellent upward facing bridge for the strength and stability of the lower back. Shoulders grounded on the floor, chin towards the chest. Feel the posture. Feel the hips and the lower back. Slowly descend. In exhale, rise. Watch your breathing. Rise the hips as much as possible. Keep the legs straight. Watch your breathing. The weight of the hips and the trunk. Of course, the legs also resisted by the back muscles. That's how they all get into action, especially the lower back. Slowly descend. Flex both the legs. Move slightly closer to the chair because we are going to increase the height at which the legs are rested. Rest both the heel on the seat of the chair. Keep the legs straight. Stretch both arms up. Shoulders pressed against the floor. Inhale, exhale, raise the hips up. Both legs straight. Hips as high as possible. The key point is that as you exhale, you should contract the abdominal muscles little more than normal. And you have to hold the posture. The muscles need some time to gear up to action. Be stable. Get involved in the posture. You have to develop that postural awareness. Slowly descend. One more time, inhale, exhale, rise. Rise the hips as high as possible. It's good for the lower back, also good for the muscles of the thigh. The abdominal muscles also stand to benefit. Legs straight. Slowly descend. Flex the legs. Relax the complete back muscles. Slowly get up. Place the blanket on the top rib of the chair. And lie on your back, taking the hips closer to the chair, because now the foot will be rested on the top rib of the chair. Rest both ankles on the top rib of the chair. Rise both arms up. Inhale, exhale. Rise the hips up. Both legs straight. Chin to the chest. Breathe well. As you contract the abdominal muscles, you should feel even the posterior region. By increasing the height, the pelvis and abdominal organs, they move towards the diaphragm. And use that reversal of direction with the breathing to mobilize those organs better. Slowly descend. Relax the legs. One more time. Rest both the ankle joints on the top of the rib of the chair. Inhale, exhale, rise. Chin to the chest. So these movements also help the neck muscles because they give a good flexion movement for the neck. They will also help the thyroid and parathyroid glands. These postures go a long way in protecting the health of the back. Slowly come down. Relax the back, slowly get up. Keep the folded blanket on the lower rib of the chair. Sit upright on a blanket. Inhale, exhale, turn to your right side. Left hand on right knee, right hand fingertips on the floor. Twisting postures give a good relief for the abdominal and the lower back muscles. Slowly come up, change side. Inhale, exhale, turn. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Slowly come up. Now we are going to do another downward facing bridge. Press both the palms, sit in the all fours, middle finger pointing forward. Rest the feet on the lower rib of the chair. Inhale, exhale, rise the hips. Hold the trunk in balance. As you exhale, contract the abdominal muscles. Spread the fingers, press the palm. So in all these postures, pressing the palm is also equally important. Flex the knees, slowly come down. By pressing the palms firmly, we are also activating all the reflexology points located on the surface of the palm. One more time, inhale, exhale, raise the hips, legs straight. Palms pressed firmly, feel your wrist, elbow, shoulders, complete trunk. Flex the knee, slowly come down. Sit on your heel. We shall now increase the height. Use the seat of the chair for support. Press the palm. Move slightly closer to the chair. Press the palm, middle finger pointing forward. Inhale, exhale. Rise the hips up. Keep both the feet on the chair. Stretch the toes. Watch your abdominal muscles. All these postures also help to strengthen the abdominal muscles. Breathe well. Slowly bring the knees down. Be gentle while coming down. One more time. Right leg up, then the left leg, rise the hips up, both legs straight, both arms straight. Keep the neck in line with the trunk. These bridge postures greatly help to strengthen and stabilize the lower back. This obviously includes strengthening the abdominal muscles. Flex the knees, slowly descend. Rest the foot on the lower rib. Sit on your heel. Sit upright. Place the blanket on top rib of the chair. The height of the support for the feet is now raised up. Press the palm, middle finger pointing forward. Feet touching the seat of the chair, rise up, then take right leg up and then the left leg onto the top of the chair. Both legs straight. Slowly bring the legs down, sit on your heel. As the height increases, when you descend, ensure that you do not crash land on your knees. One more time, both the palm on the mat, feet on the seat of the chair, then move onto the top rib, legs straight. Watch your breathing, watch your posture. All these bridge postures are good for the core muscles. So these are the muscles which stabilize, especially the lower back. Slowly come down, sit upright. Put both blankets one on top of the other, hips on the blanket, foot on the mat, sit upright. Eyes gently closed. Relax your tongue, nose, throat and the jaws. Have complete musculoskeletal awareness. Chest and navel up. Relax the shoulders. Have complete postural awareness. Watch the feet, ankles, lower legs, knees, thighs, the hips, the pelvic cavity, abdominal cavity, chest cavity, the shoulder complex, upper arms, elbows, forearms, wrists, palms, fingers, fingertips. Again there is forearms, elbows, upper arms, shoulder complex, throat and the neck, facial muscles and organs, complete skull cavity. Pay attention to your breathing. Just watch the incoming air and outgoing air. Do not try to control the breath, but just watch the breath. Feel the natural flow of the breath. How it enters in through the nostrils, which nostril is dominant. Just pay close attention to the incoming air and outgoing air. Mind is fond of past and future. Try to be in the present. Now we are going to do the following. You are going to count from 100 to 1 in the descending order. Mentally, without using the lips or the tongue. You have to mentally start from 100, then give a gap of about 4 to 5 seconds, then 99, then again 4 to 5 seconds gap, then 98, so on and so forth till 1. You can start now. You have started counting from 100 to 1 in the descending order. Don't be in a hurry. There should be 4 to 5 seconds gap between each count. Mind is very turbulent in nature. Lot of thoughts come. They rise, stay for a while, and they fall, and something else rises. But do not allow that to happen. Focus on your counting. For that you have to be present. You must come out of that compulsive thinking pattern of the mind. This is a simple technique. to come out of that compulsive thinking mode of the mind. Be aware. Develop that sharp awareness where you are feeling the posture, you are feeling the breath, you are also counting. Your focus should be on the numbers that you are counting in the descending order. Just pay attention. It is possible that the mind skips, shifts to variety of thoughts, but refocus. It needs practice. This is a simple technique which also helps to assess the status of our mind. The more and more your mind can come to the present, the clarity of counting increases. You are counting the numbers in the descending order. Be aware, be watchful. You are also witnessing your posture, witnessing your breathing. You have to turn your attention completely inward. The mind is an instrument, antahkarana. It should not be allowed to go on its own. That is when it gets into that compulsive mode of constant thinking, shuttling from past to future, future to past, totally missing the present. This is a simple technique of meditation to train the mind to come out of this habitual pattern and to get focused. Even if you miss some counts, don't get discouraged. Keep moving. Do not fight with the mind. You must just try to come to the present. Hopefully by now you have counted. You can assess the state of your mind. Because the mind got stuck deeply in one thought, not able to move out of it, or the mind was settling sometimes in the present, then lost somewhere, or the mind could be in a highly dormant state, leading to drowsiness, feeling sleepy, or it could be greatly focused so that your counting was with clarity and precision. This also needs practice. So it's good to do this at least for about 5 minutes every day, so that you will learn to break the pattern of habitual and compulsive thinking in the mind. That is a big step in the path of meditation. Namaste.